This is significant not just for the people who are eligible to receive an additional dose, a fourth dose, you put it, but also because it gives us a very clear indication. On the same day we're expecting the government to lift all remaining restrictions on COVID, just what their strategy is and how reliant that strategy is going to be on vaccinations moving forward. First of all, they're calling it a spring booster campaign. It's not specific to a particular date. It's really, they're offering an additional dose of the vaccine to people who are over 75 or immunosuppressed. It's more than 7 million people who are over 75 and 500,000 people who are in the broadest immunocompromised category will be offered another dose about 6 months after they received their last dose, which for most of them will have been a booster vaccine, a third dose. Now, the strategy here is it's very much precautionary, the JCVI are insisting to us. This is not in response to any new information. It's not in response to any suggestion that vaccine protection is waning any faster than was expected. We knew protection waned. It's pretty good, even against Omicron. After 3 doses for the over 75s, they're currently protected by about 90% protection from going to hospital. It's dropped to about 88% in 10 weeks after that jab. So it's a very modest drop. But as we all know from previously, small arithmetical changes can add up to big statistical ones. So precautionarily, if you give a fourth dose, a booster, in spring, 6 months after the first one, that should extend protection at least into this year. What's happening now, of course, with those restrictions being lifted, we're expecting the government to announce an end to mandatory isolation. We're also expecting to end free testing, although, as you said a second ago, we're still waiting to hear the details of that and some disagreements over exactly how it will play out. That does mean a period of uncertainty. We don't quite know what this year is going to look like. That's another reason I think that JCVI wants to reinforce that vaccine wall, and it shows how reliant on it we're going to be. We also heard today confirmation there will be an autumn booster programme as well. So it's highly likely that same group of people will be offered an additional booster vaccine in the autumn before the winter, when we know if we are going to have a problem with COVID, it's most likely to be then, and the NHS is going to be most risk then. And also, as the data accumulates, those of us in younger age groups may also be invited for booster vaccinations. That hasn't been ruled out. So again, we're looking at the government reinforcing that vaccine wall, because really effectively, after today, assuming those restrictions are lifted, it's the vaccines on which we're entirely reliant to protect us against COVID-19.